Hello there, my name is Julia. I'm a birth doula and hypnobirthing educator, and today I'm going to be discussing a common question of, is a birth center right for you? I'm going to be offering 10 questions that will hopefully allow you to get to that answer. Now, there's no right or wrong answer to this question. There's no right or wrong way to birth. This is all about figuring out what is right for you so that you can have the birth that you want. First question is, what is your risk level? Birth centers are typically for low risk pregnancies. But a lot of times, just because you're over the age of 35, you're dumped into the bucket of high risk geriatric pregnancy. So really have a conversation of what is your actual risk level. You want to take into consideration things like gestational diabetes, preeclampsia. Some birth centers don't even accept VBACs. That really all depends. If you have certain medical conditions or complications, a hospital might be a better fit, but there are many different variations of what normal and low risk is. And I really encourage you to dig in, ask those questions to your provider to figure out what is your true risk level. Question number 2 is, how do you feel about non-medical pain management? Birth centers don't offer epidurals. So if you're like, give me the drugs, the birth center is probably not for you. So you want to think of non-medical comfort measures like maybe water immersion, counter pressure, light touch massage, breathing, a TENS unit, using movement, using a peanut ball, an exercise ball, slow dancing, walking, thinking of things like this, HypnoBirthing. These are going to be your comfort measures. Some birth centers do offer nitrous oxide, kind of like laughing gas, as a pain management. For some women, it does work, but I wouldn't say that it's not to the same level of what an epidural gives you. Sometimes women say that the nitrous doesn't even work. So again, do your research on that and think about, what is my comfort level with pain management? Question number 3, what kind of birth environment speaks to you? Oftentimes, birth centers give a more homey atmosphere. Again, home looks different for everyone. But typically birth centers are not as sterile. You typically have a room, maybe a queen size bed. It's just a lot more cozy. Usually there are tubs in the birth centers. They still have all of the necessary equipment. Like they have the needles and the more medical sterile things, but it just isn't as overt as it would be in a hospital. But every birth center is different. So maybe you want to take a tour of your birth center to see, okay, can you envision and see yourself birthing here? Question number 4 is, how do you feel about the midwifery model of care? Most birth centers are run by midwives, and midwives typically view birth as a normal, natural, healthy function of the body, the physiology of birth. Now, I'm not saying that OBGYNs and hospitals don't, but they often see it through the lens of pathology, looking at birth as a medical event, as something that they have to do or fix or intervene with. You'll often receive longer visits and more personalized care. Your visits can be anywhere between 30 and 60 minutes. So it's not that in, out, what? I don't even know what I'm doing. You really do get more personalized care, which leads to more positive experiences, feeling like you can ask these questions, have open conversations so that you can have true informed consent. Question number 5 is, what are your thoughts on medical interventions? Birth centers practice evidence-based care, and typically what that means is they thoughtfully use interventions when beneficial, but they don't use them just as standard or routine practice. Typically, it means that you're not given a routine IV. You have maybe intermittent fetal monitoring with a Doppler, but also are equipped to deal if any kind of medical complication comes up. If you have bleeding, they do have Pitocin. If there is a shoulder dystocia, if you need stitches if you tear, they are still well versed in birth and know what to do. Midwives are trained to recognize when something isn't normal and might need more attention, and then go from there while still having personalized care. Most of the times you are not lumped into a bucket of, oh, yep, here we go, 40 weeks. Oh, you got to do this, or, oh, one high blood pressure reading there. It's a lot more thoughtful. Next question is, how do you feel about safety? This is a top priority for most women, of the safety of yourself and your baby. Birth centers, again, are typically for low-risk pregnancies, but midwives are highly trained to recognize when something isn't right. And they have protocols for when you might need to transfer out and have additional care. Ask yourself, are you comfortable with this safety approach? How do you feel about transferring? where is the nearest hospital nearby? I know one of my local birth centers is right across the street from the hospital. So that gives a lot of women peace of mind, but maybe it looks different in your area. For others, knowing that the experienced hands of a midwife is enough for them. Again, there's no right or wrong answer, just what feels comfortable for you. Next question is, how do you feel about recovery time and the immediate postpartum? Most birth centers after you deliver do not keep you for a while, maybe 4, 8, max 12 hours. You go home usually right away. Now, if you deliver at 2 a.m., they'll probably have you go home at like 6 or 7 a.m. You're not there for a while. So, if you really want to get home quickly, a birth center might be right for you. Next question is, do you trust your body to birth? Birth centers are built on the belief that birth is normal. So, ask yourself the question, are you confident in your own ability to birth? That really is helpful in figuring out your why and what your birth goals are to say, if you are, yeah, I trust it. If it's normal, yeah, this is just a normal everyday event, that might give you more confidence to say, maybe I don't need the epidural or I can do this. Like, let's work with it. If you have a deep trust in your body and maybe even feel excited about your upcoming birth, that's something to really think about and lean into. Next question is, do you want to labor freely? Most birth centers give you a lot of freedom, whether it's freedom to move, eat, use water, tub. There is structure and they do have, certain protocols, but it's not as strict as most hospital births. You have a lot of freedom. If that freedom excites you, a birth center could be a perfect fit. And the last question is, what does your intuition say? After listening to all of these questions, what is your gut reaction? Your intuition is a really powerful tool, so listen to it, now in your pregnancy and in your labor and birth, because at the end of the day, it's what makes you feel the best. What do you want this birth experience to be? This is yours and yours alone. There is no one size fits all for birth. So whether you decide to birth at a birth center, at a hospital, home, have a free birth, make the decisions that feel right for you. Every birth is unique. Yours is no different. And I hope you find the tools, resources, and support to allow you to have the birth that you've dreamed of. I hope you have a great day, and I'll see you in my next video.